Hey folks, here we are talking about a third degree heart block. That's right, one of the things that most people hate dealing with, and that is trying to identify a complete heart block. So we're going to follow through the rules and the definitions here, and hopefully at the end of this, you're going to have a better idea of what it is that we're looking for. So our first thing that we want to be able to do is ask ourselves the question whether or not this is a readable strip. Okay, so is this a readable strip? And again, all I'm looking for here is to determine whether or not I can identify waves. And in this case, I can see some P waves, Qrs complexes, and what it believes to be T waves. So I'm pretty good with this being a readable strip. My next thing that I need to take a look at is, are my P waves present or absent? So I'm going to circle, just for here, for right now, the things that I believe to be P waves. And I do see that I have P waves. Now, this one here can be a little problem because the paper has been cut off, so I'm not sure whether or not that has a QRS that's going to follow it a little bit later on. So just for simplicity's sake, we're going to eliminate this one right here. We're not going to use it at all. So my answer to this question is yes, they are present. So now I'm going to, let's go back here and let me erase some things here for you. I'm going to follow our rules, and we said, hey, I have a P wave that's present. Now I want to know, do I have a P wave for every QRS? So this becomes a complicated question a lot of times, because if I want to know if I have a P wave for every QRS, do these two have a relationship, as do these have a relationship? And this one definitely appears to have a relationship, because of just the way that it's close-like. So my question is, do I have a P wave for every QRS? And when I come in here, and my answer here is going to be a resounding yes. I have a P wave for every QRS. Now I'm going to just change colors here and say, do I have a QRS for every P? And again, we're going to block this one out, but I have a P wave that is here, and it's missing a QRS. I have a P wave that is here that is missing a QRS. I think that this is a P wave, and I think that that is definitely a P wave, and it almost looks like there may be one that's sitting down in here. So when I get to QRS for every P wave, my answer here is going to be a no. So that immediately takes me down to a few areas. Now what I mean by a few areas, so what I mean by that is, am I dealing with things such as a second degree type 2? Am I dealing with a second degree type 1? So I want to know, am I dealing with a second degree 1? Am I dealing with a second degree 2? Or am I going to be dealing with a third degree heart block? So I have the combination of all those things, right? These are the things that I'm taking a look at, so I want to know which one it's going to be. Okay, so just for here, let me put the second degree 1, second degree 2, and a third degree heart block, right? So these are the ones that I'm kind of narrowing things down with. So we're going to take a few questions here. We'll see how we have to answer these, because immediately I am taking all this into consideration. I'm going to move my calipers up, and let's go with something that we absolutely know are P waves. So right here are two P waves. I'm very confident that these are two P waves. So I can go either way. I can go forward, and I notice that they are tracking, and it's pretty evident right here that these are appearing to be regular. And if I come back here, look at this. I have, this is actually a P wave. Okay, so I have P waves, and when I notice that it is regular, so I can answer this question right here, are my P waves regular? And my answer there is going to be yes. Now I want to know about my PR interval. So again, my PR interval is going to go from the beginning of my P wave to the beginning of my Qrs complex. And here, this P wave, or I'm sorry, this PR interval is going to be 5, 10, 11, 12, 13, 14 blocks, right? PR interval of 0.56. Now I'm going to come down here and let's see, I noticed that it's actually variable, and that's actually a little bit shorter, and this one's a little bit shorter. Now, keep in mind that if I'm dealing with anything such as a second degree 2 or a second degree 1, for those rules to follow, they have to be consistent. So therefore, this has not been a consistent PR interval because I have drop beats in here. So my PR interval is going to be variable. And since my PR interval is variable, I notice that it is not really consistent because it is only appearing there whenever there may be a QRS complex. But I can tell that my atrial rate here, if I bring my calipers back, and I'm going to, remember I said when we calculated this, or when we put these things together, that I had a P to P that looked to be pretty good, and it was regular the whole way through. So in this case, I am now going to bring in and say that here is where that one QRS complex is, and here is where the other QRS complex is going to be. So this is representing 300, this is 150, 100, here is 75. So I know that this is probably somewhere around 80. Now if I want to get my exact number, we're going to go back and say, hey, I have 1,500 small blocks in a 1-minute strip. And if I divide that, I have 5, 10, 15, 16, 17. If I divide that by 17, I come up with an atrial rate of 88. Okay? So, we have that atrial rate of 88. The next thing we want to take a look at is going to be our QRS. Is our QRS complexes, are they regular or irregular? So I'm going to, again, use my calipers. And now I'm going to move my calipers down. And lo and behold, they are. They are regular. So I have an atrial rate that is at 88, and my ventricular rate, or my ventricular QRS complexes are actually regular. So we're going to take a look at this, and we're going to say, yes, they are regular. So therefore, we're going to circle this as being regular. And now I want to know what my ventricular rate is since I already have these set. Again, here is a, here is a QRS complex. It would be here. Here's another one that is here. And when I blend those two things together, I have a 300, a 150, a 100, 75, 60, 50. Now, once I get here, it really becomes inaccurate. So for me, I would much rather, I would prefer that we calculate out the number of blocks that are here. Okay, so I know that there's 5, 10, 15, 20, 25, 30, 35, 40, 45. I have 45 blocks that are in between here, and when I calculate out 45 blocks, I am looking at 1,500 divided by 45, a ventricular rate of 33. Okay? Now, let's take a look at the QRS duration, because we didn't measure that yet. So, let's go ahead and, since we're here, we're just going to move this. We'll just go right here. And I'm going to use this side of the calipers just because I think it's going to be a little bit easier for us. So the question is, where does this end and where does the T wave begin? So I'm going to say that from where I am standing, or from where I am looking, I'm going to bring this straight down and say that it probably ends about right here. So when I do that, I have set my calipers, and now I'm just going to move it into an area in which I can move. And this is 5 small blocks, so my QRS duration here is at 0.20. Okay, so actually let me erase that because that is what I know it to be. And if it is at 0.20, we know that that is greater than the 0.12, which we've seen before, which is telling me that this is probably something that is coming out of the ventricles, right? So this could be something that is coming out of the ventricles based off of the width of the QRS complex. So now we need to apply what we know about our rolls. So we're going to move our calipers out of the way. And now we know that in a second degree type 1, that that is a Winky block. A second degree type 1 block says that we have a PR interval that gets longer. Well, this one is not getting progressively longer, so we can cross that one out. A second degree type 2 says that where there is a P wave and a QRS together, that the PR interval should stay the same. Now, if we take a look here, we will notice that this PR interval does not stay the same. You can tell here that all three of these are different. So the PR intervals stay the same. And if you're looking for that one, we do have a little video short already up on that, so go ahead and take a look at it. With a third degree heart block, we know that there is no relationship. Okay, so there's no relationship between the P waves and the Qrs complex. So in that case, we are now going to call this a complete heart block. We have more P waves than Qrs complexes. They are both functioning independently of each other. Now, I don't want to get into a whole lot of treatment with you here, but what I can tell you is that when I take a look at something like this, you need to keep one thought in mind, that the heart, as we said it in this aspect, I have my AV node, I have my SA node that is sitting up here. I have my internodal pathways. And then somewhere right in here is going to be my AV node. Now in through here, I have all of these internodal pathways in through the bundle of His, which then brings everything down. So again, what is happening here is that there is a block, and that block is appearing somewhere between here and here. So if that block is appearing there, it depends on whether or not the impulse gets through. If the impulse gets through, so the SA node, we know based off of the P waves that are here, these things are firing. And since they're firing, that indicates that this is okay. But what's happening is somewhere between the SA node firing and somewhere along that AV node, there is a problem. So what are we going to find out about that? Where can we tell where that's at? Well, sometimes we can't. But from an EKG, it may give us a good idea of what's happening. And this is when we actually take a look now at that Qrs complex. So if we look at this Qrs complex, when we say that we're looking at the width of this QRS, if it is coming from the ventricles, so here we saw that this had a Qrs duration of greater than 0.12, that tells us that the ventricles are actually being the backup pacemaker. We know this because the impulse coming from the SA node probably traveled down to the AV node, and the AV node processed it. However, the block is occurring in a brief area right after the AV node. Therefore, the ventricles never received the impulse. That's why they're the backup. If, in fact, it was higher up in the AV junction area, anywhere in there, if the AV node is functioning properly, it should have detected that there was a problem and did not receive a beat. Therefore, it would have fired itself. And in that case, we would have found a Qrs duration that would have been less than 0.12. So just a little hint, gives you an idea of what we're looking at when it comes down to determining third degree heart blocks and how those treatments are going to be. By the way, this is a firing at a normal rate. That atrial rate is firing at a normal rate. Remember, we're talking it should be firing somewhere between 60 and 100 times per minute. Okay, I think that's it for a complete heart block. I don't want to get into any type of treatment with that, but gives you an idea a little bit later on in relationship to treatment of complete heart blocks, why some medications may or may not work. And we'll see you on the next one.